Hey guys, welcome back to my channel. My name is Darlene and this is Earth and Medicine. So if you guys are new to my channel, a little bit about me. I am a fourth-year medical student in Southern Nevada, and I'm currently on my ICU rotation. So this week is my second week on ICU, and I kind of gave a little bit of updates of how the first few days went last week, and it was definitely pretty stressful. I was a bit overwhelmed with the volume of patients, and then also just kind of the intense things we see in the hospital. They get all like food territorial, and so Candy is looking at her boyfriend's grain. He's getting kind of upset. Yesterday I actually saw my first patient pass away after we stopped a code. We were doing CPR on this patient and family agreed, and so we let the patient pass away. It was a pretty profound experience. I've never seen that before, and it was kind of a very fast transition of us trying to bring this person back to life to deciding to withdraw care and pretty much deciding that now this is this person's time to pass. So that was pretty intense, and I just kind of had to stand there for a little bit and absorb the situation and just kind of process it a little bit before we moved on. It's hard because it's like there's not really a whole lot of time to process. And of course, like, these very strong emotions will come up as we are running a code and we're seeing these crazy things, but then we have to move on to the next patient right away. And so these emotions kind of get buried down. And I noticed that I kind of have to take a second to just like process them and let them go. Otherwise, I'll just keep having them build up and build up. And I know that that's not healthy. We actually did a really good wellness exercise last week with our wellness coordinator for the residency program, and we all just kind of gathered in a conference room and just kind of talked about our experiences. It allowed people to open up and express their emotions and just kind of talk about things that we don't ever really talk about that much while we are rounding on patients and when we are practicing medicine. So I thought that that was really helpful. This was something that I was just experiencing this week, especially with a lot of patients that I feel kind of closely attached to. There's been a lot of young patients who are suffering from the after effects of COVID, and they are like not much older than me. And so of course I put myself in their shoes, and I'm just like, I can't imagine being in this kind of situation and being intubated and how my family would feel. And so I just really had to allow myself to process my emotions and the things that come up for me when I'm seeing these situations. I remember last week I was also talking about how I kind of felt overwhelmed with knowing where to start when I'm going to treat ICU patients. And as a medical student, I'm not exactly treating patients, but I'm practicing. And so it was hard for me last week, kind of feeling lost and not really knowing where to begin. And I'd be like, what if I was a resident right now? What would I do? And this week I'm actually starting to feel a little bit more like I know where to start. And kind of like I was saying last week, I know it'll just take time and repetition and seeing these kinds of situations and patients multiple times. And so I feel like through last week I had a good amount of experience, and then this week I'm just kind of building on that. And so I feel a little bit more confident, and I feel better when I'm presenting to the doctors, to our attending physicians, and I just kind of feel like a little bit more helpful part of a team. Sorry about the airplanes flying over right now. This is kind of the flight path for flights coming into Las Vegas, so there's always a plane flying overhead. Oh, I almost forgot Tomorrow I actually have my first residency interview, and it is with the University of Nevada, Las Vegas. So I'm very excited. I'm a little nervous. My palms are getting sweaty just kind of thinking about it and talking about it. But I am excited, and I know that I just need to relax and be myself, and it's gonna go great. So I'll let you guys know how it goes and wish me luck. By the time this video comes out, I will already have done my interview and possibly 2 more. I kind of forget my schedule. So tonight I'm just gonna kind of take some time to relax, and I'm going to be with my horse and clean stalls and just do my normal barn routine. I'm just gonna kind of ground myself out here in the desert with my horse and do all those awesome things I love doing, just to reset after being at the hospital. Okay, let's head into the ranch. It is kind of cold out here, so I'm gonna go get my jacket before I go into the ranch. So there's something really relaxing about cleaning stalls, and I'm not really sure what it is. Maybe it's just like the repetitive motions and it's kind of meditative, but I just love coming out here and just cleaning my horse's stall and just kind of like seeing the difference from when I get here and it's really dirty to when I'm finished and it's nice and clean, and it makes me feel better because I know my horse is gonna have somewhere clean to sleep because she likes to lie down when she sleeps. I just like cleaning, and it just kind of helps me like let go of tension, and I think my thoughts, it's just like really therapeutic for me. So I'm actually gonna let the horses out for a little bit and just let them run, and then I will head home and prepare for my interview tomorrow.
my senior feed right now. Some Purina. So I actually reuse these grain bags as trash bags at home. So just kind of to try to help reduce waste in the world and reuse things. So yeah, that's a little trick.